Genital psoriasis affects approximately 6 million Americans, or 2/3 of individuals with plaque psoriasis, and there hasn't been any consensus on how to manage this condition within most published guidelines. To shore up this gap, the Genital Psoriasis Wellness Consortium recently published new consensus statements on the impact of genital psoriasis. The consortium, convened by Arcutis, was made up of a multidisciplinary group of clinicians who aim to provide guidance on the diagnosis and treatment of genital psoriasis, information on its impact on quality of life and interpersonal relationships, and actionable tips on how to have conversations with patients about this condition. Their findings are published in the Journal of the European Academy of Dermatology and Venereology Clinical Practice. In this episode of the JDNPPA News and Views podcast, study author Melodie Young, a nurse practitioner at Mindful Dermatology in Dallas-Fort Worth, Texas, and the immediate past president of Society of Dermatology Nurse Practitioners, discusses the impetus for the new paper and how they can be applied in practice.
I have spent the majority of my career studying psoriasis, taking care of psoriatic patients, and trying to find therapies and gaps in care, see what we're missing, see what we could do better. And Jennifer Cather and I have worked together for nearly 25 years, and we kept noticing a common theme, which was the missing of genital psoriasis. So the misdiagnosis by patients or other clinicians, and also the discomfort that patients had in talking about it, and also clinicians. When you talk about genital psoriasis at advisory boards or at conferences, a lot of times the room would become so quiet, a pin would drop, because you're now showing pictures of genitalia at a derm conference or at a rheumatology conference. And it started to make us realize even more that we were not listening to patients' complaints fully, or we were not seeing what was bothering them. So we decided we need to delve into it. A couple of things. One is we feel like there's a increased need for awareness that it exists. We want patients to know that it's not their fault. It's part of their psoriasis, even though it often does not look like psoriasis. So there's a misdiagnosis or a lack of diagnosis, a lack of exam of the area, lack of ability to communicate with patients. We just started, you just ask patients about the area inside of their underwear, and you get all sorts of descriptions and words that are used. And we realize that there's just not a common language. There's not a common routine for how the exam occurs. And again, if you don't diagnose it correctly and put the right medication to that area or come up with the right treatment for it, patients are literally going to take the matter into their own hands. So we started realizing it's very prevalent, very widespread. 4 out of 5 patients have currently or have had genital psoriasis in those patients who had psoriatic disease. And it rarely looks like psoriasis, so it's easily misdiagnosed. And then they're often ashamed, or they think it's contagious, or they're embarrassed, or they think it's hygiene related. And then they just don't know how to speak with us. So one of the things that I also know is that we see this a lot in a younger population, and that's incredibly difficult. And a lot of the medicines we've had heretofore, particularly topical corticosteroids, they can be very damaging to that tissue. And so if you give a person a class 3, 2, 1 steroid to use elsewhere, we found out a lot of times they're using those products in areas where we did not prescribe them to be applied, like in the genital region or perianal region. So we again found there's just so many opportunities for missteps along the way that the derms need to take a hold of. We need to take responsibility. We should not leave this to the patient to sort it out by themselves. If they ask us about it, we need to deal with it. We found that it was over 40% of the time when patients brought it up to their healthcare provider that I think I have something in my genital region, that we weren't looking, we weren't addressing it, or we weren't giving them a medicine for that area. And when we did a couple of focus groups and advisory boards among physician, well-established, board-certified dermatologists, as well as talking with some NPs and PAs, what we found out is experience and intelligence and competency in treating psoriasis did not necessarily translate into effectiveness in diagnosing or managing genital psoriasis. So we decided that we were going to put together a consensus group, and we got a psychologist, we got gynecology, we tried to get a mix of ages, of parts of the country and types of practice together and say, okay, how do you deal with this? And we began to discover how we deal with it and how patients bring it up and things that work. And then we started saying there was a huge discomfort. It was shocking. I mean, that's part of your skin. And, making it a topic that's not awkward and trying to give patients permission to talk about it, the comfort with it, try to come up with, here's the way it needs to be examined, here's the way it needs to be discussed, and here's the way it needs to be treated. And that's really what the consensus statement was about. We wanted to focus on that sort of last frontier of really managing psoriatic disease of the skin. So, and how it affects our practice, our goal, our hope is that we're going to talk about it. We're going to ask patients, hey, by chance, do you have any rash or any lesions anywhere in your genital or perianal area? You could, some people call it in your privates. Some will say inside your underwear. I've heard, in your pink parts. I mean, there's so many slang terms, but as professionals, we're gonna say genitalia. And I've had people say, what is that? Just so you just have to speak to the age group, the community, the region that you're talking with in a way to say, if you've got something going on there, it could be part of psoriasis. And also, if you ask them and they say, no, the tissue there, the skin there is perfectly normal and healthy. Okay, great. But if you ever have anything that develops in those areas, I'm the person, tell me about it. Because some of the medicines I might be using, you may not be the best. We have other things. We have systemic, biologic, topical medicines that really have been studied in these areas that we need to know about. And make sure there's not a misdiagnosis where they think it's yeast, because you'll see that people have gone through just an inordinate amount of therapies that didn't work because it's the wrong diagnosis. So we want to make it a comfortable situation. We even had talked about things if a person calls the front desk to make an appointment and to say they don't even really know how to say, I have something that I need you to look at, because it can be that you only have it there, maybe your belly button or maybe some nail pits. It doesn't necessarily mean you've got it all over. It can be just in those areas. I mean, we've seen, drugs that are approved for treatment if you only have it in those areas. So we want it to affect the practice from the front desk to the medical assistants, to the nursing staff, to the physicians, the NPs and PAs. Everybody be aware this is a thing. You are going to see it. We want you to see it. We want you to talk about it. We want you to correctly diagnose it, correctly treat it, and make it where people know what they have and how to deal with it. And some of the quality of life issues related to ineffective or improper treatment of the genital region, the impact on sexual health and psychological health is huge. I have so many stories of patients that would tell me things, or I've had patients sent to me with such severe psoriasis on their labia that the gynecologist said, or the OB would say, we need to deliver. I'm afraid to deliver vaginal because their skin's just going to tear. I think I'm going to do a C-section, and can you fix that? I mean, it just has such a huge impact. And I think it's an opportunity for derm to flex a little bit, that we do this, we can handle this, and be the ones to approach the topic and get this resolved or get treatments underway. I would like to challenge all clinicians, but I am going to focus on my derm nurse practitioner colleagues and derm PA colleagues to be the group that embraces this opportunity to help patients with what has been a very uncomfortable and sometimes very awkward exam or conversation. And very likely the data shows us, and we know that we've not done a great job in assessing and managing and educating on genital and perianal psoriasis. So come on, NPs, PAs, and dermatologists. Let's do this. Let's help people with something that's going to be incredibly meaningful.
Thank you for listening to this episode of the JDNPPA News and Views podcast. We hope you learned more about the diagnosis and treatment of genital psoriasis.